Hello, everybody in podcast land. I'm Dr. Ted Thatchenkary, and this is MD Roundtable, a podcast about collaborating and learning from other healthcare professionals from all over the globe. We are all so much more connected due to technology. We have so much to learn from each other. Thanks for joining us today at MD Roundtable. This is a very special episode as we are featuring Kelli Newman, who is president of the Houston-based communication strategies firm Newman & Newman, where she leads a team of talented professionals dedicated to advancing the success of purpose-driven clients. Her work centers on formulation of brand messaging strategies and development of award-winning marketing communication tools for corporate, nonprofit, and government clients. Welcome to MD Roundtable, Kelli.
Oh, thank you so much. I appreciate the opportunity.
Great. Fantastic. I know you're a very busy person, so I really appreciate you being here.
I really always enjoy this. Is a favorite topic, so it's not difficult to carve out time for this.
Great. Well, first off, Kelli, why don't you tell us a little about yourself? Like, for example, where did you grow up? Where's home?
Oh, gosh. Okay. I grew up in Portland, Oregon, graduated from Oregon State University in broadcast media and speech communications, and actually had the incredible opportunity of covering as a reporter the eruption of Mount St. Helens right out of the gate. So I've had the opportunity to do some really exciting things and work with some exciting people. But about, now it's almost 35 years, I think. My husband and I felt like we were ready to move into a larger market, and he was doing some work down in Houston on a national radio program he was producing and said, I think we ought to check out Houston. So we moved here. Well, we came to visit in April and we moved here in August. And if you've ever moved to Houston in August, you know, it was a real culture shock. So, but we love it here. And Houston has a way of sucking you in with its incredible culture of anything's possible. And a lot of folks come here thinking they're only going to be here a few years. And 40 years later, they're still here.
Yeah, that's great. I've been to Houston. It's a very nice city and very multicultural, very diverse, which is what I liked about it.
Yes, definitely. That is a big asset.
Yeah, that's a drastic move from Portland to Houston.
Well, we kind of have maintained contact on both ends. All of our family is back up there. In fact, I'm heading back there next week. So we've lived in kind of two different cultures all of our adult lives.
Yeah. Now, I assume, did you go to college in Portland?
No, I went to Oregon State University in Corvallis, but in Oregon. So I'm an Oregon State Beaver, not to be confused with a University of Oregon Duck.
Got it. Okay. Yeah, my son and I, we just watched the movie Air.
Oh, yes. Yeah.
And, we came to learn that the Nike headquarters is in Portland, correct?
Yeah, it's only about 3 miles from my family home. So yeah, it's Nike's been a big part of that community, as you can imagine.
Right. Fantastic, Kelli. What have been some of your biggest challenges that you've had to overcome, as you went through school, your training, to get to where you are now?
Oh, gosh. Well, as I said, I began as a reporter, and then not too long into that, realized that the folks I was chasing down were the ones that had the information, and that's what I wanted. So I switched from reporting into public relations, which is not uncommon at all. And when we moved to Houston, I had always really enjoyed the clients I'd worked with that were in, let's say, purpose-driven categories, so education, healthcare. and had the good fortune after we moved to Houston to work as a public affairs specialist for Baylor College of Medicine and worked with Dr. DeBakey in the very formation years of the DeBakey Heart Center, and then was recruited to Texas Children's Hospital, where I was director of public relations. Then left there and joined my husband in our firm. So we've kind of gone through the gamut of healthcare communications for a long time.
That's wonderful, Kelli. Yeah. So can you tell the audience what Newman and Newman does, and like what inspired you to get involved with Newman with your husband?
Well, other than if you don't join me, I'm going to have to hire some people. And yeah, no, we very purposefully developed our company to make a difference. And I know that sounds super corny, but that's why we don't work with retail. We don't work with manufacturing. We don't work with oil and gas. Ironically, although our offices are located in the energy corridor of Houston, the clients that we work with are very much purpose-driven. So healthcare, innovation, nonprofits, because our team of professionals here all share a very strong commitment to feeling like what we're doing ultimately impacts lives. So an example of that would be we're working on a campaign right now to prevent deaths of stranded motorists on the highway. So that's it's not so much a healthcare related project, but it's very indicative of the kinds of things that we do. And for our healthcare clients, that can cover the gamut of developing brand messaging that would distinguish them from other organizations, either like them or within the larger category of healthcare providing services. It can be development of marketing tools in engaging their key audiences. And then most recently, about 6 years ago, we developed a new service line that we have named Experienced Messaging.
Okay. And would you say your target market is like you said, more in the healthcare field, or?
Definitely healthcare, but also entrepreneurs that are in maybe the life sciences, medical device sectors of innovation, nonprofit organizations, typically medium to large, not a lot of small nonprofits, but it's organizations that are in some capacity providing a service as opposed to a product to the people that they're either caring for or responding to.
I see. What's your experience been working with doctors? Are they easy to work with?
Well, it kind of depends on which kind of doctor you're talking about. It can be a tough audience. One of my colleagues here and I were talking the other day. We conducted a workshop not too long ago it was a combined providers audience of physicians, nurse practitioners, physician assistants. And you could tell who in that audience was a physician because they usually have a look on their face like, and you're going to tell me something? But the ironic thing is, as communication specialists, I also find that physicians are sometimes the first to admit that their communication skills may not be something that they've had an opportunity to cultivate. And not that they don't have good communication skills, but it just was never really made a significant part of their training. And it has so much to do with the connection that they make with patients that it can be a real frustration. And so physician communications has always been at some point in the nucleus of our healthcare work that we've done.
Right, definitely. Are you doing work directly with like inpatient physician groups as far as helping them improve their patient satisfaction, scores that are tied to HCAHPS, et cetera?
Yeah, so the experience messaging service line that I mentioned to you, for the healthcare application, we just published a new case study of work that we did with a urgent care system that is in multiple cities here in Texas. And so they're in that clinical arena. But yes, definitely in terms of in-house. And that's something that I think is especially important right now because of where everyone is post-pandemic. And I think everyone agrees that we're not likely to go back into the same, let's say, general healthcare cultures, forgetting that, each organization has its own culture. And so there's a lot of new technologies and new approaches that are being applied, but certainly it's a good time for a refresh in terms of how organizations describe who they are in terms of distinguishing themselves, and then how that translates into what their patients experience. It's really interesting if you look at, say, negative patient comments that are part of a hospital or other inpatient or even outpatient organization. So often they center on communications issues. So I felt like I wasn't heard. I felt rushed. There's obviously other things that can show up in that, but so oftentimes communications is at the center of that. And I think that communications has very important application to internal audiences, that being employees of those organizations as well. And I think that everyone's had an opportunity really across all industries to do some reflecting on how authentic is what people are saying or what this organization says it is, and what I as an employee or even I as a patient experiencing. It was interesting. Salesforce Research did a study back in 2020, and they asked people across industries, and the results showed that the experience that an organization or company provides is as important as its product or services. And I think that goes back to trust and establishing trust. So if you say, this is what our hospital, for instance, brand is about, it sets up expectations. And that's great. There's nothing wrong with that. You want to do that, especially in terms of competing with other like organizations. But if those expectations aren't met, then you risk the trust on the part of employees and on the part of patients that can be very difficult to recapture.
Yes, definitely. Yeah, I think on the inpatient side, just from my personal experience, Kelly, a lot of physicians, we do struggle with communication. And like you said, I think the challenges have been hard just because of the time crunch, the amount of patients we're seeing, rounding on the documentation that we have to do, on our EMR systems. So yeah, it's challenging. I mean, personally, it is very challenging. I could tell you as a hospitalist, you could be the greatest or the most knowledgeable doctor out there, but if you don't have the bedside manner, that's essentially you're gonna have low patient satisfaction scores.
Well, here's the thing that I think is so interesting too, and everything you said is 100% correct. Number one is that time crunch is just in front of everyone. Our daughter-in-law is an RN, and I know from the nursing perspective also what that pressure of time represents. And I think that a lot of providers, physicians across the board feel that communication means that it requires more time. And it doesn't. It's a different attention that does not require necessarily more time. And I think also that what's interesting is very oftentimes when we're, say, engaged with an organization and providing them with some assessment and formulating recommendations, what we find is that the dissatisfied patient, let's say, that has logged a negative comment, that same physician has walked out of that room with a completely different impression a lot of times, where maybe 90% of the time when they learn that there was a negative comment recorded, they're really surprised. Like, I thought that went super well. And
Right.
so part of it is just helping to bridge those understandings of what patients and their families are looking for and how they interpret from their perspective of not obviously knowing medicine, but from their perspective, whether they've had excellent service or not.
Right. Yes, I agree with you. And I think scripting, I don't know if you agree with me, but I think scripting doesn't always work.
Oh, no.
I know a
Mm-mm.
lot of the systems want you to use scripts and how you talk to patients, but I think every patient is different. And, I notice a lot of times that you kind of have to go off script.
Oh, 100%. We are not advocates of scripting at all. In fact, we've had a couple clients that have said when our engagement has included maybe conducting some workshops for their staff and helping with some of their communication skills, we tell them right up front, look, our focus is not on scripting. We're not going to tell anybody you get within 3 feet of someone, you extend your hand, you make eye contact. Those formulas, they don't work. And there's actually research that shows that number one, patients recognize inauthenticity. Number two, it's very difficult for someone to really carry off something that doesn't come naturally to them. And
Right.
everyone has their own strengths. And it's really a matter of developing your own signature style. Now, that being said, what's important for attention to feel like it's been satisfied and for patient satisfaction to be satisfied is that patient connection. And there's a lot of things that contribute to that. And certainly it has to do with, some things like sitting down, making eye contact, using active listening, those kinds of things. One of the things that's really interesting that we discovered in our own research is that there's a study that shows healthcare providers typically interrupt their patients after 18 seconds. And I think that that's because they're all thinking of the time crunch. So, okay, let's get to the bottom line here. Or they may genuinely think that they can help that patient get to, the punchline faster.
Mm-hmm.
But to be interrupted is obviously off-putting, and it's not helping create that patient connection. And that same study found that if you'll let that patient talk for 3 minutes, which can seem like forever, and it doesn't usually take that long, you
Mm-hmm.
can walk away with about 90% of a complete history. So it's little things like that where you pay
Right.
attention as far as making a connection. It's also connecting with emotions, which means it's not just what you say, but how you say it. So sometimes, let's say a hospitalist might come into a room and feel like if they're casual, maybe comes in the room and says, so what's going on? They may even think, well, I'm even diffusing the fear or some of the anxiety that may be present in that room. But it doesn't do a lot to connect with the emotions of that patient. And instead, if they walked in and said, I understand you've been running a fever for the last 24 hours or something like that, that number
Mm-hmm.
one demonstrates that they've looked at the chart, but also is a little bit more engaging other than just being kind of flippant. Those are all little things that make a difference. But to go back to the point, it's not, I'm going to give you a script and these are the words that you need to walk in the room and repeat. Right. It's what feels comfortable to you.
Yes, definitely. I think it's, like you said, attention, compassion, empathy, and engagement. And you nailed it on the head with a lot of doctors, they tend to interrupt their patients after 18 seconds. I mean, I know personally, I've had to hold myself back from doing that. It's not easy, but it's constant improvement. And there's a lot of self-talk that's going on in your own head. And, like you said, active listening is huge. And yeah, these are all great points that you bring up.
I also think that for physicians in particular, but healthcare providers across the board, when they hear that they should be empathetic, I think that they find that confusing and maybe even offensive because by definition, I have chosen this career, this profession, and I am therefore a compassionate, empathetic person. But there's a difference between compassion and empathy. And I'll give you those two definitions. So compassion is the desire to act on a person's behalf, ultimately to prevent the suffering of others. So compassion really inherently defines healthcare. Whereas empathy is an awareness for other person's emotions and putting yourself in their shoes. So it doesn't matter that you've had that same exact experience, but it's connecting on that emotion. I mean, we all know fear, we all know frustration. And so when you connect on that, it provides that empathy that is so important for patient connection. And sometimes it's just a matter of thinking through, okay, if this was a family member and I was walking into the room, how would I speak to them? How would I be empathetic? How might I engage with their emotion differently than how I might with a complete stranger who's a patient? And so I think that, there can be a little bit of we use a fair amount of time teaching empathy, which, like I say, can seem so counterintuitive for people who have chosen medicine as a profession. But part of it is just understanding how empathy works and how that can be expressed in being able to engage with a patient.
Right. Great. How have you grown as an executive over the years?
Oh my gosh. I think I've been really, really fortunate to have excellent mentors, to be able to observe really dynamic and fantastic professionals. I don't know if you're familiar with really famous pediatrician, Dr. Ralph Feigin. He was physician in chief at Texas Children's Hospital when I was there. And he was just so fantastic in how he didn't just encourage people, no matter what their responsibilities were, to excellence. He infused in you that feeling, if not me, who? I mean, he just helped you feel like, why not? Why can't you? And actually, that's part of the draw, I think, for the culture in Houston, is that I think you would be hard pressed to come here and tell someone that you have maybe what to others sounds like a crazy idea. And in Houston, I swear across the board, they'd say, okay, great. So how are you going to do that? Not that sounds like a crazy idea. And so I've really had the opportunity to inject into my own leadership skills the best of what I've seen in other people that I've really had the honor to work with.
Great. What's a tough question that you've had to ask yourself lately?
Oh, wow. How do you get on top of this impatience DNA that you have running through you?
Yeah.
It just feels like there's so many things that I want to accomplish. And it's that time factor, I guess, that all of us feel. But yeah, I think that's one of the things I have really appreciated about, getting further along in my career, where you're not second guessing yourself all the time. It really feels good to walk into a room and feel like, look, what I'm going to tell you is really correct. And not because I'm God's gift to communication strategists, but I've had enough experiences where I know that what I'm saying is true. So I think that has felt really great. But what I probably have the hardest conversations with myself on are, don't rush it, take it a step at a time, try to squelch that impatience.
Great. All great points you make there, Kelli. Tell us a little bit about the Ignite Health Network and how you are involved.
Oh, that's a great question. So Ignite was founded by Aisha McCracken, and it was formed to elevate the role and the influence of women in leadership roles within healthcare. So she gathered together women executives that are in roles that influence the future of healthcare in some capacity. So from my perspective, it's communications. From other perspectives, it's as physicians. From other perspectives, it's as entrepreneurs and innovators. and developed this collective in sharing information and encouraging the industry in moving more women into executive roles and also in nurturing women innovators. There's an annual competition called Fire Pitch, which began just fairly locally. And now we have I think this will be the 6th year coming up this fall. There's finalists from really all over the world. And what's unique about that is rather than just competing for dollars, the innovators are partnered with mentors and customer organizations ultimately for the innovation that they've developed. And so there's almost an accelerator component to that. And this year there's a series of workshops that are being conducted. I'm conducting one on communications and marketing, and then there's other folks that are investors. And so it's really been a wonderful organization to be part of. I was really honored to be invited as a founding member, and then just finished last year a 3-year stint on the board.
That's extraordinary. Yeah. Congratulations with your work on that, Kelli.
Thank you.
What are some things that excite you the most right now in your field?
Oh, gosh. I think that there is a new level of appreciation for communication strategies and the idea that it's not just tactics. I just spoke at a conference last week, and I was asking that audience, how many of you have board members, for instance, that come to you and say, we need a billboard or we need a digital ad campaign or something? And as humans, we naturally flock to those tangibles, those tangible tactics, because we can touch and feel and see them. But what happens that can be frustrating and can compromise the success of those tools is the why. And as organizations, whether it's healthcare or otherwise, a lot of times the focus is on providing either a dry inventory list of services provided, or even in healthcare, especially kind of a pie in the sky, we're the absolute best, but not necessarily with substance that you can hang your hat on or that patients can understand. And instead, that the importance of capturing the essence of an organization and reflecting in its messaging not just its purpose, but its values and its culture, and how that can make a difference in connecting with audiences. I think that my experience is that there is a new appreciation and understanding of that. And when you can provide that why of why your organization exists, and shout out to Simon Sinek, who I'm a big advocate of because he introduced us all to the importance of why in his book back in 2009. But I think that there really is a new appreciation for that. And it's provided additional traction and maybe a little bit less need for education on our part to help people understand the importance of that.
Great. Thank you for sharing that, Kelli. What are some of your interests outside the office? How do you decompress?
Ooh, for sure, gardening. My mother is truly a master gardener, and I don't come close to her skills, but I love to garden and just spend time in the yard. Spreading mulch or bark dust isn't my favorite thing anymore, but I've done plenty of that. So definitely gardening. We are big hikers. We love, Houston does not afford us the time in the mountains that we love. So whenever we can, my husband and I look forward to spending time in the mountains. And then I would be remiss if I didn't mention that come November, we're going to be grandparents for the first time. So,
congratulations.
Thank you. So that is a whole other thing that I'm looking forward to. And I have refinishing projects and all kinds of things that I'm doing related to our grandson that we just can't wait to have arrive.
That's awesome. Congratulations.
Thank you.
Kelly, if there was something that you'd like to say to your colleagues in this space, is there any message or thoughts that you would like to share?
I think in terms of speaking to healthcare providers, I think, first of all, I mean, my gosh, talking about working your tails off. I mean, gosh, I'm just so impressed with the depth of dedication and commitment that healthcare providers across the board in all capacities have demonstrated. And I think that I had Chief Medical Officer describe the other day that we are in a period of recovery where people are slowly but surely getting their feet back on the ground. And I don't think anyone questions the dedication and the commitment to our healthcare providers. And so when an organization like ours comes in and says, let us help you with your communications, let us help you improve your patient experience, let us help you retain and recruit employees. It is certainly not from a perspective of criticism. It's how can we further support you? Because people have just demonstrated just heroic commitment. And so I think that that's number one. For fellow communications professionals, I think that we definitely came out of the pandemic, maybe extremely challenged and frustrated on the sidelines for the contribution poor communication had in perhaps unnecessarily complicating and obstructing some of the things that could have happened in that experience. So I think that perhaps there is a new appreciation for the importance of communication, and when there is not a concerted effort and maybe even a required effort towards communication, what that can mean. So it's been an interesting era that we are coming out of, and I think that it will be really interesting to see the benefits that it imposes.
Yeah, having said that, Kelly, is there a way that listeners can get a hold of you or get in contact with you?
Sure, of course. Well, first of all, to go back to the experienced messaging, they can simply Google experienced messaging and we'll pop up. We originated that, so we're not hard to find there. And then our website is a little bit lengthy, but it's Newman, spelled Newman, the word and, Newman again, inc.com. So it's Newman and Newman Inc. for incorporated.com. And we have all kinds of resources available there as well, not just obviously an explanation of our services, but there are articles, there are podcasts, there are videos, there's all kinds of free and easily accessed information that can be helpful to folks.
Great, fantastic. And I will include that in my show notes as well, okay?
Great.
Well, Kelly, thank you so much for your time. And I think that was a very informative discussion for our listeners. I appreciate you sharing your story on MD Roundtable.
Well, thank you. And I have to say, I really have enjoyed this podcast after discovering it. So thank you for what you're doing and the super interesting topics that you're bringing to the folks that are following you.
Oh, thank you so much, Kelly. I appreciate that. Have a great day, okay?
All right, you too.
Thank you. Folks, if you enjoyed that episode, don't forget to leave a review of MD Roundtable Podcast, and don't forget to subscribe. Also, if you want to reach out to me with any comments or questions, feel free to go ahead and email me at drtedthachenkary at gmail.com. Once again, drtedthachenkary at gmail.com. I will also leave the email contact in my show notes. Thank you again for joining me. Have a great day.